Diabetic gastroparesis, a very short section, doesn't fit in with anything else. So let's take 5 minutes to do all diabetic gastroparesis. The same way that a person who is diabetic and has diabetes, we know that after 10 to 20 to 15 years, 15 and 20 years of diabetes, we know that you should expect to have peripheral neuropathy. You shouldn't be able to feel your feet. We know that you should be numb and not sensing your feet. If there's pain, we use gabapentin or pregabalin because you're not sensing your feet and you have peripheral neuropathy. The gabapentin, pregabalin, tricyclics. Gabapentin, pregabalin, tricyclics is when you have pain. We know that you have erectile dysfunction because you're not sensing your penis, and you use sildenafil, tadalafil, vardenafil, which is known as Cialis, Viagra, and the other drugs that make the pecker go up. We know that you have a person, you have eye problems, 10 and 15 and 20 years, you have eye problems, and you screen for retinopathy. We use VEGF inhibitors, ranibizumab, bevacizumab. We use medications and we use laser photocoagulation. So you accept these things. You don't have a problem with them because you say, well, it's of course you have neuropathy and erectile dysfunction. You have eye problems. You should be screening with the urinalysis, but the urinalysis, even when it's negative, we should be looking for microalbuminuria where it's 50 to 300 micrograms, teeny little amounts. What's less than trace? What's less than trace? Now, one of the ones that gets left out is diabetic gastroparesis. Medical students, doctors, nobody has a problem with the idea that after a long period of diabetes, you have neuropathy because you've damaged the vasonervorum around the nerves. Whether it's little twigs of nerves, glove and stocking neuropathy, or mononeuritis multiplex, which is nerves that are large enough to have names. People don't have a problem with the neuropathy because we know that diabetes hurts the blood vessels that supply the nerves, and you get neuropathy. Hurts the blood vessels that supplies the nerves, and you have neuropathy. We know it hurts the blood vessels that supply the penis, and you have erectile dysfunction. It hurts the blood vessels in your eye, and those blood vessels in your eye scream for relief. Help us. And we need to stop the blood vessels from growing with laser photocoagulation, VEGF inhibitors like ranibizumab, bevacizumab. We know that even if the urinalysis shows nothing, there's microalbuminuria, which is what is called less than trace. And the reason I'm bringing this up there is that this is so highly tested that if you don't know about this, you shouldn't even walk into your test. You shouldn't even walk into your test. Now, diabetic gastroparesis is very similar to these things. Gastroparesis means you don't sense the stretch of your stomach. What is the greatest stimulant to motility of the bowel? It's stretch, distension. What's the greatest stimulant to the bowel? It's stretch. It's distension. And when you can't sense the stimulation of your foot, you get a foot ulcer. When you can't sense the distension and the stimulation to your foot, you get a foot ulcer. That's why you need podiatric visits. When you can't sense the stretch to your penis, you have erectile dysfunction. When you can't sense the stretch of your stomach, you have GI motility disorders, and you have constipation, and sometimes alternating with diarrhea because you can't sense the stretch, and you don't have normal motility, and you have constipation alternating with diarrhea when it overfills. And it's very simple. We use some things like erythromycin or metoclopramide. And these things increase GI motility. Now, in a normal person, what's the most common adverse effect of erythromycin? In a normal person, the most common adverse effect of erythromycin is diarrhea, vomiting, diarrhea, vomiting, because it increases motilin. It increases motilin because it makes you, I like to move it. You like to move it. We like to move it. And it moves your butt. But a person who has too much erythromycin makes you vomit, makes you have diarrhea. But what if you don't have enough motility? Then erythromycin increases your motility. And metoclopramide also increases your motility. So erythromycin increases your motility and therefore treats your diabetic gastroparesis. So erythromycin fixes the lack of sensation of your bowels. So if you don't have enough motility, you don't sense the stretch, because I don't sense my feet, I don't sense my penis, I don't sense my eyes. Same thing is happening in the GI tract, diabetic gastroparesis. This motility is too little. You're a normal person taking erythromycin. It increases motility. This motility is too much. Nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea. You take a person with diabetic gastroparesis and you give them erythromycin. This motility is just right. It's Goldilocks in the 3 GI tracts. This motility is too little. This motility is too much. I give you erythromycin for diabetic gastroparesis. This motility is just right. That's the answer. Nuclear emptying scan, give them barium-soaked bread. Who does it? Not necessary. But it is the most accurate test. Nuclear soaked bread, barium-soaked bread is the most accurate test. Not necessary. See you in the next section.